Welcome to this explainer. Imagine this. It's May 2026, and a luxury polar expedition aboard the MV Hondius suddenly turns into an absolute real-life medical thriller. What started as just one isolated illness in literally some of the most remote waters on Earth, well, it quickly spiraled into a massive global health event. We're talking medical evacuations, international contact tracing, the whole shebang.
Okay, let's dive into this, because right from the very start, we hit a massive, glaring contradiction. Health authorities were coming out, reassuring everybody, saying the risk of this outbreak spreading widely was incredibly low. But at the exact same time, they're deploying military-grade quarantines, they're shutting down ports, they're sending in guys in full hazmat suits. So you gotta ask yourself, why the extreme panic over a supposedly low-risk threat?
To really understand this mystery, let's take a step back and define what we're actually dealing with here. The pathogen is the Andes Hantavirus. Now, like most hantaviruses, it's zoonotic. That basically means it jumps from animals to humans, usually spreading when someone comes into contact with the urine, droppings, or saliva of infected rodents. But here's the kicker. This Andes strain, which you'll mostly find down in South America, is totally unique. It is actually the only hantavirus known to spread from human to human. And while that kind of transmission is super rare, when it does happen, the consequences are absolutely devastating.
And that sheer severity really boils down to one absolutely staggering number: 38 to 50%. That is the historical case fatality rate for the Andes strain in the Americas. I mean, just let that sink in for a second. We are talking about incredibly high stakes here. A pathogen that carries up to a 50% risk of death. Yeah, that immediately explains why everyone was on such high alert regarding this specific strain.
So how does it actually attack the body? Well, in the first few days, honestly, it just mimics a common flu. You get a fever, extreme fatigue, muscle aches, maybe some dizziness. Then, it often moves into severe gastrointestinal issues like nausea and stomach pain. But then, it hits the cardiopulmonary phase, and things escalate incredibly fast. Imagine thinking you just have the flu while you're miles out at sea, only for it to rapidly accelerate into heavy coughing, cardiovascular shock, and severe fluid buildup in your lungs, literally within a matter of hours.
Let's move to and see how this builds, because the timeline of this ship's journey really shows how fast things went south. The MV Hondius departs Ushuaia, Argentina on April 1st, heading out on a polar expedition. They're hitting these incredibly remote spots. April 14th, they stop at Tristan da Cunha. On April 24th, 29 passengers actually disembark at St. Helena and fly home. But it wasn't until May 2nd that the WHO was formally notified of a cluster of severe respiratory illnesses, which already included an initial fatality. By May 6th, the entire ship was under strict quarantine protocols and diverted straight toward Tenerife. Now, looking at the numbers, we're dealing with a highly concentrated cluster. As of early May, we're talking about just 10 cases in total between the people on board and those who left early. 6 of those were lab-confirmed as the Andes virus, and 4 were suspected. But here's the truly terrifying part. Out of those 10 individuals, 3 had already passed away. So yeah, the total number of infections is relatively small, but the devastating impact within that tiny group, that is exactly what put global health agencies on such high alert.
Now, what's really interesting about this is the profound gap between the official narrative and the reality on the ground. You have the WHO officially stating that the wider risk to the public is low. But then you look at Cape Verde. When the ship tried to divert there for medical evacs, local authorities weren't taking any chances. They flat out refused full entry, created a strict maritime isolation zone, and deployed a rapid response team. The calming words from the WHO just completely contradicted Cape Verde's defensive posture.
And we see another totally jarring visual contradiction when we look at the medical responders. The official guidance emphasized that this virus only spreads through very close, prolonged contact. Okay, fair enough. But if it's really that hard to catch, why were the medical teams boarding the ship for routine checks decked out in full level 3 hazmat suits and face shields? I mean, seeing medical professionals encapsulated in extreme protective gear sends a massively different, much more alarming message to the public than a simple low-risk warning, right?
Meanwhile, authorities weren't just tracking people. They were racing against an incubation period that could stretch anywhere from 7 up to 39 days. This essentially created 3 distinct ticking clocks. You've got Group A, the 144 passengers still stuck on the ship, facing the longest risk window. Then, Group B, the 29 folks who disembarked early at St. Helena. And finally, Group C, everyone on that commercial flight taking the St. Helena group to Johannesburg. Health agencies had to watch these groups like a hawk to ensure no new cases popped up before each danger window finally closed.
But let's take a breath and separate the science from the hazmat suit panic for a second. Dr. Scott Pagan over at UC Riverside puts it really well. He points out that the Andes virus is just not in the same category of transmissibility as something like measles or COVID-19. It's not this highly contagious airborne pandemic waiting to happen. It really does require the exchange of bodily fluids or very intimate contact. On average, an infected person transmits it to less than one other person.
So, thankfully, we aren't dealing with a respiratory virus that easily sweeps through a casual crowd. So the crucial point is, if it's so hard to catch, why on earth did it spread? Well, it's the ship itself. A cruise ship is quite literally the perfect catalyst. Think about it. Close living quarters, shared indoor spaces for weeks on end, frequent interpersonal interactions. You're getting prolonged exposure to infected individuals long before they even start showing symptoms. The ship effectively acted as a giant floating incubator, creating the exact type of sustained contact this virus needs to jump between humans.
Of course, figuring out what they were actually dealing with took a massive, frantic global laboratory effort. It was rapid genomic sequencing over at the National Institute for Communicable Diseases in South Africa that finally cracked the case. By testing samples from the evacuated patients, the NICD definitively confirmed, yes, this is the Andes orthohantavirus. And that major breakthrough was what finally unlocked all the specific protocols and global warnings that followed.
But yet again, we hit another contradiction. The CDC here in the US activates its Emergency Operations Center at level 3, which is their lowest tier, basically signaling to the general American public, hey, your risk is extremely low. But their actual actions? Completely different story. 17 American passengers were flown on a specially chartered government flight directly to the National Quarantine Unit at Nebraska Medical Center. That is literally the only federally funded biocontainment unit in the entire country.
And while tracking the ship was a headache, the real logistical nightmare started the second passengers left that controlled environment. Expanding the ring of contact tracing once people enter the global commercial travel network is phenomenally difficult. Authorities were no longer just tracking a boat, they were suddenly tracking commercial flights, busy airports, and countless secondary contacts spread across multiple continents.
This exponentially expanding ring set off some massive secondary alarms. For instance, a KLM flight attendant actually had to be hospitalized with symptoms after interacting with a dying passenger in Johannesburg. Thankfully, she later tested negative. Over in the US, 2 New Jersey residents had to be strictly monitored, not because they were ever on the cruise, but just because they shared a flight with someone who was. And in Spain, their contact tracing actually failed twice, simply because passengers decided to swap seats on their flights. It just shows how fragile our global tracking networks really are.
All of this brings us to what might be the most fundamental question of the entire event. If this thing doesn't spread easily between humans and requires close contact, how in the world did a rare South American pathogen end up circulating on a Dutch-flagged vessel floating in the middle of the ocean? To answer that, we have to shift our focus away from the human response and look back at the ecological source.
The WHO's working hypothesis points squarely at the index case, or patient 0. This was a 58-year-old German tourist who boarded the ship on April 1st. Now, crucially, before he even got on the Hondius, he had spent over 3 months traveling around Argentina and Chile. Health officials strongly suspect he was exposed to infected rodents out in the environment, maybe while doing something as simple as bird watching in Patagonia, and he contracted the virus before ever stepping foot on the deck.
But why did he encounter infected rodents in the first place? Experts like biologist Dr. Raul Gonzalez-Idig say we need to look up from the microscope and look at the changing climate. He connects this totally isolated medical event directly to broader environmental shifts. As our ecosystems get disrupted, the natural balance of things, like predator-prey dynamics and food availability for species like rodents, gets completely altered, and that forces these zoonotic viruses into new dangerous overlaps with human populations.
And this brilliantly illustrates the climate catalyst at play. It's a perfect, deadly, ecological chain reaction. First, a severe drought hits Patagonia in 2023 and 2024. Then, the following years bring heavy, increased rainfall. That sudden rain causes an absolute explosion of vegetation, which creates a massive food supply. And what happens when there's abundant food? The rodent populations just boom. More infected mice running around simply means a much higher statistical chance of a tourist crossing paths with the virus.
So while piecing together that ecological puzzle is vital, we have to pivot to the grim medical reality on the ground. Because once someone actually contracts this virus, doctors are pretty much left empty-handed. Despite all of our incredible modern medical advancements, if a patient hits that cardiopulmonary phase, there is no magic pill, there is absolutely no silver bullet to kill this virus once it takes hold.
Because of that, the current medical response protocols are entirely defensive. Right now, there is zero WHO-approved or licensed vaccine anywhere in the world for the Andes strain. On top of that, there's no specific antiviral treatment available either, so survival relies entirely on intensive supportive care. Doctors have to catch it as early as possible, get the patient transferred to an ICU immediately, and rely on mechanical ventilation and food control to keep their organs going, just hoping the patient's own immune system can win the battle.
Which brings us to the core takeaway of the Hondius mystery. We've got a virus emerging from an ecosystem totally thrown off balance by climate shifts.
catching tourists unaware. And when it did spread, our institutions told the public the risk was low while simultaneously rolling out biocontainment units and military-grade hazmat suits. As our changing planet makes these rare pathogen spillovers more and more likely, we have to ask ourselves, are our public health systems communicating these complex, emerging threats with the transparency and consistency we need to truly stay safe? It's a question we absolutely need to answer before the next outbreak hits. Thanks for learning with us on this explainer.
Awareness is the first line of protection. Share the information and subscribe to the channel.